Close your eyes for a moment, and let's travel back, far back, to a time before hospitals, before antibiotics, before anyone truly understood what made the human body sick or well. Let's go to medieval Europe, a world lit by candlelight and firelight, a world where a headache could be blamed on the moon, where a fever could be treated with leeches, and where the person holding the knife over you might also be your barber. Tonight, we're going to walk slowly through the strange, well-meaning, and often terrifying world of medieval medicine. There's no need to remember any of it. Just let the details drift past you like smoke curling up from a low fire as your body settles deeper into the bed and your mind lets go. If your body had too much blood, or too much of any humor really, the logical solution to a medieval physician was simple. Remove some of it. Bloodletting was, without question, one of the most widespread treatments in medieval medicine. It was used for headaches, for fevers, for sore throats, for melancholy, for plague, for almost anything really. There were two common methods. The first involved a small blade used to open a vein, usually at the arm, and letting the blood drip slowly into a basin. Physicians followed detailed charts showing exactly which vein to open depending on the illness, and depending even on the position of the stars. The second method used leeches, small, dark, patient creatures, placed directly onto the skin, left to feed slowly for as long as the physician judged necessary. Leeches were so central to medical practice that in many towns, physicians were sometimes nicknamed after them. A patient might be bled once or several times over the course of an illness. It was common, disturbingly common, for a sick and weakened body to be bled again and again, each time growing a little weaker, while the fever or infection underneath remained completely untouched. We know now, of course, that this often made patients far worse. Blood loss on top of illness, weakness on top of weakness. But at the time, if the patient didn't recover, it wasn't seen as a failure of the treatment. It was simply seen as a sign that the illness had been too strong, or the imbalance too deep. Here is something that tends to surprise people the first time they hear it. In medieval towns, the person most likely to perform bloodletting, and even minor surgery, was not always a physician. Often, it was the local barber. Barbers of the period didn't only cut hair. They pulled teeth. They lanced boils. They set broken bones. They performed bloodletting. And yes, they also performed amputations when absolutely necessary. This wasn't seen as strange at the time. Barbers were skilled with sharp blades, steady hands, and precise cuts. Skills that transferred easily from trimming a beard to opening a vein. Physicians, meanwhile, were considered above such manual work. A university-trained physician often diagnosed the illness, decided on the treatment, and then left the actual cutting to the barber surgeon. You can still find a quiet echo of this history today, in the red and white striped pole outside old-fashioned barber shops. Red for blood, white for the bandages. There was no anesthesia, of course, no sterilization as we understand it now. A patient undergoing surgery might be given wine or a strong drink, or in some cases, a sponge soaked in herbs, meant to bring on drowsiness. Survival depended heavily on luck, on the skill of the barber's hands, and on how the body handled the shock and the risk of infection afterward. Now, this next one sounds almost impossible to believe, But it's true, and it long predates the medieval period, continuing on well into it. Trepanation was the practice of drilling, or scraping, a hole directly into the skull. It was used for all kinds of reasons: severe headaches, seizures, head injuries. Sometimes doctors believed it could release trapped evil spirits, or relieve dangerous pressure they believed was building inside the head. Remarkably, archaeological evidence shows that some patients survived this procedure, sometimes more than once, based on skulls found with several healed trepanation holes. The bone around the opening shows signs of healing, meaning the person lived on afterward, at least for some time. Still, without any understanding of infection, without sterile tools, the risks were enormous. Many patients likely did not survive, and yet physicians continued the practice for centuries, guided by careful, confident reasoning that, to us now, sounds almost dreamlike in how wrong it was. Let's slow down here for a moment and picture something you may have seen before, without knowing quite what it was. A long, dark robe, a wide-brimmed hat, and a mask shaped like a bird with a long, curved beak. This was the plague doctor. During outbreaks of the Black Death, certain towns hired physicians specifically to treat plague victims. Their strange costume wasn't decoration. It was, in its own mistaken way, an attempt at protection. The long robe was often coated in wax, meant to form a barrier against the disease. The beak of the mask was packed with dried flowers, herbs, spices, sometimes lavender, sometimes mint, sometimes stronger substances like camphor. The idea was that the plague spread through foul-smelling air, what they called miasma, and that filling the beak with pleasant, strong scents could filter and purify the air before it reached the doctor's lungs. They didn't know, of course, about bacteria, about fleas, about the true way the plague spread. But you have to imagine what it must have felt like to see one of these doctors approaching down a narrow street, footsteps slow and heavy, in a town already emptied by fear and death. A strange, beaked shadow, moving from house to house, carrying with it both the hope of help and the unmistakable presence of the plague itself. Many plague doctors had little real medical training. Some were simply the only people willing to take the job, drawn by the promise of high pay, in a time when few others dared go near the sick at all. Here is something else that might feel unfamiliar to modern ears. Medieval physicians didn't simply examine the body. Many of them consulted the stars. It was widely believed that the position of the planets and the phase of the moon directly influenced health. Physicians used detailed charts, called zodiac man diagrams, showing which part of the body was ruled by which sign of the zodiac. Before performing bloodletting, before prescribing herbs, a careful physician might first check an almanac. Was the moon in the right phase? Was Mars in a dangerous position? Certain days were considered unlucky for certain treatments, and a physician who ignored this was seen as reckless, not brave. This wasn't seen as separate from medicine. It was medicine. Astrology at the time was simply considered another branch of natural science, as legitimate as anatomy or herbalism. Now, let's drift slowly through some of the remedies themselves, not to shock you, but simply to notice how differently people once understood the world. For toothaches, some remedies suggested writing prayers on small pieces of paper and pressing them against the aching tooth. For fevers, Cool compresses were common, but so too were prayers and small amulets, often worn around the neck, believed to draw the illness away from the body. For skin conditions, physicians sometimes prescribed ointments made from animal fat, mixed with herbs like comfrey or plantain, ingredients that, in fairness, did have some genuine soothing properties, even if the reasoning behind them wasn't fully understood. Some texts recommended more unusual ingredients: powdered gemstones, ground unicorn horn, which in reality was usually narwhal tusk, though almost no one knew that at the time. Mercury, now known to be highly toxic, was used to treat various skin diseases, and later syphilis, often causing more harm than the illness itself. And for the wealthy, there was something called theriac, an extremely complex remedy, sometimes containing dozens of ingredients, including viper flesh, opium, and honey, all aged together for months. It was believed to cure almost anything, from poison to plague, and it remained popular for an astonishingly long time. Centuries, in fact, long after the medieval period had ended. Childbirth in the medieval period was, quite simply, one of the most dangerous events a woman could go through. It rarely involved physicians at all. Instead, it was managed almost entirely by midwives, women with practical, hands-on experience passed down through years of practice, rather than formal medical training. Midwives understood a great deal through observation, positioning, herbal remedies to ease pain or to help labor progress, warm compresses, quiet, steady reassurance in a room usually filled with only women, mothers, sisters, neighbors, gathered to help. Complications, when they arose, were often impossible to treat with the knowledge of the time. There was no understanding of infection control, no safe way to perform surgical intervention in most cases. Both mothers and infants faced real, significant risk, and losses were, sadly, common enough that they were woven quietly into the fabric of everyday life. And yet, within these limits, midwives developed a surprising depth of practical skill, knowledge that, in some form, echoes even into modern midwifery today. Monastery medicine. Away from the noise of towns, in the quiet stone hallways of monasteries, a very different kind of medicine was practiced. Monks and nuns often maintained herb gardens, carefully tended, filled with plants believed to have healing properties: sage for memory and digestion, chamomile for calm and sleep, rosemary for the mind. Many of these plants, we now know, genuinely do have mild therapeutic effects, discovered slowly through centuries of quiet trial and observation. Monasteries also preserved ancient medical texts, copied carefully by hand, generation after generation, keeping alive fragments of Greek and Roman medical knowledge that might otherwise have been lost entirely. Many monasteries maintained an infirmary, a quiet room set aside for the sick, where monks skilled in herbal remedies tended to both fellow brothers and often travelers and townspeople who had nowhere else to turn. There was something calm about this kind of medicine, slower, rooted in routine, in prayer, in the gentle rhythm of daily monastic life. Not always effective by our modern standards, but delivered at least with patience and care. So there it is, a slow walk through a world of leeches and bloodletting and beaked masks moving through empty streets, a world where a headache might be blamed on the moon and a fever treated with prayer and powdered gemstones and quiet herbs grown in a monastery garden. It's strange, isn't it, to think how confident they all were, how certain, each physician, each barber, each midwife, doing their very best with the knowledge they had in a world that hadn't yet discovered so much of what we now take for granted. There's nothing you need to remember from any of this. Just let it settle, quietly, like dust in an old stone room. The candle is low now. The night is long and calm, and there's nowhere else you need to be, except here, warm, still, drifting slowly into sleep.